Last but not least is that the final launch is the mental health node. The mental health node is funded by NHS Scotland. It's been largely built by another of our research fellows, Dr Joyce Wilkinson. He has overseen the development of the actual evidence summaries and best practices, but he's worked very, very closely with an international expert reference group chaired by Dr Denise Coyer, who's the Principal Medical Officer for Mental Health for the Scottish Government. And there's been huge involvement of mental health professionals within Scotland, as well as a large number of mental health professionals around the world in the corresponding reference group. And I'm pleased to say that we have with us today Dr Joyce Wilkinson from Scotland, who will say a few words about the mental health node, and I will ask her to then formally launch the JBI CONNECT mental health node. Joyce?
Thanks very much, Alan. I'm very pleased to have this opportunity to be part of this quite significant event for us from Scotland, but I know it is for JBI as well. I've been a member of the expert reference group, and it's been a very exciting but also quite a challenging role. And in Scotland we have taken forward the development of this node. NHS Quality Improvement Scotland have funded the node development, and I'm here very much today with the support and the good wishes to you all from Sean Doherty, who has led the development of the node from within QIS, and from Dr Denise Coyer, as Alan mentioned, the Chief Medical Officer for Mental Health in the Scottish Government. Their involvement and their decision to be involved and to fund this node really does show the high profile and the desire to really improve mental health care within Scotland and across the globe through this opportunity with JBI. While the dearth of evidence for us as practitioners to inform care has been long lamented, I'd suggest that in terms of mental health care, there's perhaps even a greater need, as Nick Royal alluded to this morning, that it really is a Cinderella of services, and people with mental health problems are often marginalised, quite often find themselves subject of ineffective or outmoded care and treatment. And so I would suggest that even more so, there's a need for a node such as this. And in the developed world, statistics would suggest that there's a 1 in 3 chance that we'll come across ourselves suffering from some sort of mental illness in our lifetime. And therefore, perhaps more than any other type of healthcare, there is a need to recognise the importance of evidence-informed care. Practitioners often complain that there's no evidence relating to mental health care practice, and I've had some experience of that as a consumer and as a healthcare professional. I've been involved in multi-agency work, particularly with drug users and mental health problems, and I've consistently come up against the problem of this no evidence, but some of the problem has been about where to look. And so I would suggest that today I would commend to you this mental health node, because I already know that there is a wealth of evidence in there, and that's on a wide range of topics, a wide range of conditions, and a wide range of effective interventions for mental health care. I know that in Scotland it's been eagerly awaited by practitioners, and I suggest probably the same world over. I've been involved over this last year in evaluating the impact of JBI CONNECT in NHS Scotland, and if I've learned one thing from that, it's that just as Alan has suggested today, JBI never stands still, it's always moving forward. And so today, the launch of the mental health node, not just a huge commendation of the work that Rasika Jaskara has done, and of Craig Lockwood and of Sean Doherty in Scotland. It's not a launch as a fait accompli. This really is a starting point for improving mental health care within NHS Scotland and globally through JBI CONNECT. So I really would, I'm so pleased to have this opportunity to formally launch the mental health node. Thank you.